is Breast Cancer Awareness Month and a fitting time to address the ongoing public debate about when women should begin having yearly mammograms. Joining us tonight to help clear up the confusion, Local 10 medical specialist Christy Kruger.
And there has been a lot of confusion, especially in the last year after the American Cancer Society released some new guidelines for breast cancer screening. It's why tonight, as we begin our Mammogram Monday series, we asked doctors to talk about breast cancer risk factors and why in some cases women may benefit from additional exams.
This is an ultrasound of that same right breast.
Dr. Erika Bloomquist, a surgical oncologist at Memorial Healthcare System, is used to answering questions about mammography. But the answers, well, they're not one size fits all.
40 has kind of been the traditional age that we start, but we're learning that risk factors play a big part in the age that we start screening.
These risk factors include ethnicity, family history, and more.
Another one is dense breast. You know, we hear a lot about that in the media and what does it mean and what do we need to do. There is some elevation in your risk of developing a breast cancer if you have dense breast.
Dense or fibrous breasts are composed of high concentrations of glandular tissue, which can make detecting a tumor more difficult during mammography.
See, it's sort of jagged and, you know, there's white and gray and you're thinking, you know, how do we find something hiding in there?
For women with dense breasts, additional imaging, such as an ultrasound, is strongly recommended. The information obtained is part of a growing trend aimed at tailoring breast cancer screening.
The mammogram did not detect my mass. It didn't detect it. They were so good to me.
Joanne Segara is a case in point. Dr. Bloomquist followed her routine mammography with an ultrasound.
The ultrasound found a very small area in her breast that was identified as abnormal.
That abnormality turned out to be breast cancer.
You know that word, when you hear it associated with you, it just takes your breath away.
Segara underwent radiation treatment and until recently breast cancer screenings every 6 months. This mother and grandmother has now been given a clean bill of health and a new reason to push for early detection.
It's 10 minutes out of your life that can save your life. Well, I have a second chance.
And to recap now, the consensus among doctors is that women should begin having those yearly mammograms at 40. And depending on the risk factors involved, a mammogram can be done earlier or in conjunction with other technology. For more information on breast cancer resources, survival stories, and they're great ones, as well as our Mammogram Monday segment, be sure to visit our breast cancer awareness page at local10.com. Back to you.